I'm going to ask you just two questions. The first one is, do you want to have good, healthy teeth all your life? I'm sure the answer to that would be a resounding yes. My second question to you would be, are you taking good care of your teeth at home? Now, I don't want you to answer that immediately. Just you can answer this after this presentation is over. Home care of teeth forms a very important part of the preventive aspect of dentistry. If you look after your teeth very well at home and subject yourself to a regular checkup once in a year, like preferably on your birthday, you can be rest assured that you will have good healthy teeth all your life. Home care constitutes brushing. So the questions that arise is, how many times should you brush, how you should brush, what toothpaste you should take, and what toothbrush you should use. Let me go the other way around. Today you are bombarded by a large number of toothpastes that are trying to tell you as to what they can do for your teeth. Let me give you a small little insight into what a tooth really is. A tooth once formed cannot be impregnated. That means anything you apply on it is not going to go inside the tooth. Okay, so all it requires or expects from you is to keep it clean. If the surface is kept clean, it is not going to decay or rot. If the area around the tooth, that is the gums, are kept clean, you can be rest assured that you will not have any gum disease. Now, the toothpaste part is over. You can use any toothpaste that you feel like using. Generally preferred is what you like in your mouth. It's all a question of taste. The finer the toothpaste, the better it is on your teeth. It doesn't abrade them, otherwise you get toothpaste which are very abrasive in nature and can literally strip off the very important enamel surfacing on your tooth. Second is, what toothbrush to use. Again, it's a very personal choice. There are three types available: soft, medium and hard. Now that consistency is for you to choose, but I would definitely like to tell you, if the brush hair have worn out and become something like this, where the brush has become flattened out, then they are of no use to you. It is time to change your toothbrush. Only when the bristles are standing straight are they of any use to you, because they meet the surface of the teeth and help clean them up. Normally what we do is, whenever we have to replace a brush, we generally try to say, okay, we put it on our list and say, okay, next time I go to the market, I'm going to pick up one. But believe me, whenever you go out to pick that one single toothbrush, it takes a lot of time to actually come to doing it, because you're most likely to forget it unless you carry a shopping list with you every day. I suggest that whenever you buy toothbrushes, buy them in multiple. So you pick up a whole lot, or you pick up a box containing a lot of toothbrushes, and then keep them at home, so that whenever the bristles go worn out or are not good for your teeth, you can immediately change it, and that will help you to keep the beauty of your teeth and the health of your teeth. Now the third question is, how many times do I brush my teeth? It is recommended to brush your teeth at least twice a day. One, after breakfast before you leave home, as the last chore that you do before leaving home. So why? After you have finished your breakfast, there are definitely going to be some remnants of food sticking to your teeth. Now, if you don't clean them out, you're carrying them with you for a long period of time, because by the time you take your next meal, it is going to be a pretty long time before you are able to brush again. So those food particles sticking there can cause you a damage to your teeth. When allowed to stay there, the remnants decay, they cause a foul mouth odor, as well as they are quite capable of creating a decay in your teeth, which we call dental caries. Now, again, when you come back home, you finish your dinner, and the last thing you do before you go to bed is to brush your teeth. So again, you would like to know why. Number one, most people would like to go to bed with a clean mouth, you know. Again, if those things are sticking in your mouth or the food is left in your mouth, then it's most likely that they're going to stay there and rot, and they get a pretty long time to sit at one place and rot. Just imagine if you're taking a sleep for say even 6 to 8 hours, then it's left there for 6 to 8 hours. Plus, when you get up in the morning, that foul smell is going to be there because it has rotted in the mouth all the time. So it's always good to brush after breakfast before you're leaving home, and last thing you do before hitting your bed is you brush your teeth. Now that comes to the last point as to how you brush your teeth. You see, allow me to use a single comb to tell you what your teeth are like. When properly arranged in your mouth, your teeth are like the teeth in a comb. So when you clean your comb, how do you go about it? You just don't go that way, do you? No. You pick up a brush or you pick up another instrument and they clean it out from the top to the bottom like that, and that's how you get a clean set of combs in your home. Similarly, when you use your brush, your nice brush with bristles that are straight up, not flattened out, what you need to do is you brush your teeth from the gums down. So this is a model of the upper teeth, and what I'm doing is I'm using the brush to brush down on the sides like this, brush down in the front like this, again brushing down on the sides like this on the right side. Inside, I'm starting from the gums, moving out, starting from the gums, moving out, and starting from the gums, moving out. Now that was the upper teeth. I'll give you a demo of what you're going to do with the lower teeth. These are the lower teeth set. Again, the same thing applies here. You brush from the gums up, here this side, from the gums up inside, from the gums up this side, and this, don't forget this part. Lower teeth, behind the lower teeth, people generally forget to brush. That's where you get a lot of deposits taking place. In the front also, again, you brush in front like this, again up like this, and again up like this from the gums. The system is that you brush from the gums and away from the gums. Okay, start brushing from that. This ensures a slight massage on your gums, because whenever you are using a toothbrush, it is important not just to clean your teeth, but also to massage your gums. So because the gums are the support system of your tooth. If they are going to be healthy, you're going to have a good time. The teeth are going to last. Otherwise, there have been instances where we have found that the teeth have to be extracted, even they're looking perfectly all right, but the gums have given way. They have been degenerated, and disease has taken over the gums, and the teeth have to fall out. Now, when I talk to you about cleaning teeth, I talk to you about two surfaces. Then there are actually, you must remember that the brush must pass over three surfaces at all times. So what are these three surfaces? The first surface is the one in front that you see. The second surface is the one on the inside that you don't see. And third surface is the place where you chew your food with. Okay? Now that takes care of three areas. But there's still one area left which needs your attention, and which is most important, because a lot of disease or decay takes place through those areas. This is the side of the teeth. Like if you have teeth standing like this, you clean this area, you clean that area, the back, and you clean in front. What your toothbrush hasn't reached is the area in between. Now this requires a system of flossing. Flossing is an activity which is conducted by a thread called a floss, and the floss is passed in between the thread, between the teeth like this, and the thread is pulled up. The result is it brings up anything which is stuck over there and keeps it clean. You must do flossing at least once in 2 or 3 days so that you keep the whole area clean. Now, there are different types of flosses available. One is a single stray thread that you get. It may be difficult for you to manage in your mouth. I recommend and use an issue like this. This is a toothpick available in the market, and what you have is here is a thread. So easy way to do is to pass this between your teeth and pull it up. Pass this teeth and you pull it up. The upper teeth you push up and take it down. Now I find this very easy to manipulate in my mouth, and I can reach almost all the teeth in my mouth. I hope that has answered any doubts that you have had in your mind. I am sure a lot of you people are doing this so fine. This is a, like a reinforcement of you have been doing and what you have been doing, and in case you are not doing this, kindly do this. So I'm sure the answer to my second question as to how you're looking after your teeth would be a mixed yes and no. I wish you very good oral health, and if you like my videos on dental health, kindly like them, share them, and do subscribe to my channel, because in the future I intend to bring in a lot of material on dental health which will take away all the all the doubts that you might have in your mind about dental health. Thank you for listening. Goodbye.